Hi again, Dr. Robert Strang, Chief Medical Officer of Health. We're announcing one additional case of COVID-19 today in the province, which brings us to a total of 15. So we have 5 cases which are confirmed by the national lab and another 10 cases which are presumptive based on a test here at our provincial lab. We know that we have cases in communities across the province. The age ranges from within their 20s to their 70s. One case has been hospitalized but is doing well. All the other cases remain at home under self-isolation and recovering. Public Health has followed up all these cases, and we're doing our work to identify anybody who's been in close contact with the case and notifying those individuals. We're making sure that they're on a 14-day self-isolation period as well and being monitored closely for the development of any symptoms that would suggest they have developed COVID-19 as well. We fully expect we're going to get more cases. We're at the beginning. We were in the first week of this, but it's really important that everything we've talked about throughout the week, all the personal preventive measures, hand washing, staying home if you're sick, cleaning surfaces, not touching your face, especially if your hands are unwashed, cough etiquette, as well as social distancing and self-isolation, which we've talked about in the last couple of days, and closing down public places so people can't congregate together. All of those things together will make the difference on how much Nova Scotia is impacted by COVID-19. So it's really important that we all do what we can to prevent the spread, but I also encourage people to look at how we can support each other in our communities. So people who are in self-isolation, how we can support them. Somebody who's elderly and really needs to be on their own right now, how do we make sure that they can be safe and they have their necessities are met? And when we talk about social distancing, what we really mean is physical distancing, and we really want to even increase our social connectedness using our devices, using the telephone, using those kinds of ways to reach out to each other. I want to just end up by talking a little bit about 811. It has a lot of, we still have a large number of people calling 811. 811 has an appropriate place, but if you're just looking for just information on COVID-19, please go to our government website, novascotia.ca/coronavirus. Lots of information there, links to other websites through that provincial website. If you think you are feeling unwell and you think you may need to have testing for COVID-19, use the 811 online assessment screening tool first. And if you do that tool, it may then direct you to 811. If you are directed by the online screening tool, by all means, call 811 and you'll do a further assessment and then be directed to one of the NSHA testing sites as appropriate. If you have other health concerns not related to COVID-19, continue to use 811 as you normally would. But it's really important that for COVID-19, only people who have the opportunity to use the online screening tool first, then be as directed. If people don't have the online screening tool, only if you've traveled and have developed fever or cough, should you be calling 811.